I'm assuming that anybody in this country who wants to train specifically for treating post-concussion syndrome or concussion patients, I mean, there is a course set up here already?
Yes, there is. It's all online. We have a course for chiropractors, physiotherapists, and osteopaths, which is kind of more of the physical rehabilitation course. And then we have an occupational therapy course as well, which is more so on cognitive rehab, return to school, return to work. And then we also have a physician and specialist course, which is for physicians, but also mental health professionals, neurooptometrists, and vision therapists.
Yeah.
There's a whole bunch of courses, and they're all online, so they're available for everybody.
Yeah, and you earlier on you mentioned a couple of things that I didn't, which could give rise to concussion. You talked about well, not least hockey, but workplace injuries and car accidents. So, as you say, there's no head injury assessment applied strictly for someone who's had a car accident. I mean, people tend to make an assumption you've got a whiplash injury if you've got any pain, but as far as I'm aware, there's no automatic assessment for concussion in this country. And maybe, Nicola, do you know better?
Well, essentially what tends to happen is that people will visit the accident and emergency, and their huge focus is making sure that somebody hasn't got a skull fracture or a brain bleed. And so what often we find is that people come to our clinic and they'll say, oh, it's okay, I've been cleared, I've just got a concussion. And so the injury itself is downplayed to be something actually fairly low-key and insignificant. Yeah. And yet that's what catches people out, because they end up with these huge symptoms that could be fairly catastrophic for their work, in terms of not being able to drive a car, or every time the windscreen wipers go they have to pull over and vomit, or some really extreme symptoms. Or we have parents that will come in and say, my son was a straight A student, and since he had a concussion, he can't read a book, but no one believes me. Is this related to his concussion? And so we can then put some treatment into place and give them reassurance that actually it is related, and it actually is an injury that needs to be treated.